Welcome to Lesson 3.2, Safe Transfers and Mobility Assistance. Many clients require help getting out of bed, standing from a chair, walking through the home, using a wheelchair, or moving between different surfaces. These activities can create serious fall and injury risks when they are performed incorrectly. In this lesson, we will discuss how to prepare for transfers, encourage client participation, use safe body mechanics, recognize unsafe situations, and respond appropriately if a client begins to fall. A transfer occurs whenever a client moves from one position or surface to another. Transfers may appear simple, but they require planning. A client's strength, balance, cognition, medical condition, mobility limitations, and required level of assistance can all affect how safely the transfer can be completed. Never assume that because a client transferred easily yesterday, the same level of assistance will be appropriate today. Before assisting with any transfer, review and follow the client's care plan. The care plan should tell you how much assistance the client needs and what equipment or precautions are required. Some clients may need standby assistance, others may require hands-on help, some may require two-person assistance or specialized equipment. Never change the transfer method on your own simply because another method seems faster or easier. Before beginning a transfer, observe the client's current condition. Can the client follow instructions? Can they sit upright safely? Can they place weight through their legs? Do they appear unusually weak, dizzy, confused, sleepy, or unsteady? If the client appears significantly different from their normal condition, do not automatically continue with the usual transfer. Report the change and follow agency procedures. A safe transfer begins before the client moves. Clear clutter and obstacles from the area. Make sure floors are dry. Position the chair, wheelchair, or other destination as close as safely possible. If using a wheelchair, make sure the brakes are locked before the client begins transferring. Footrests should be moved out of the way when appropriate so they do not become a tripping hazard. The client should also have secure, non-slip footwear when appropriate. Communication is essential. Never suddenly pull, lift, or move a client without explaining what you are about to do. Tell the client where they are moving and what you need them to do. For example, you may tell the client to move toward the edge of the chair, place their feet securely on the floor, and push from the chair when instructed. Give the client time to process your instructions. A simple countdown, such as 1, 2, 3, can help both of you move together. Care partners can also be injured during transfers. Back, shoulder, and muscle injuries often occur when caregivers lift incorrectly, twist while supporting weight, or attempt transfers that require more help than they can safely provide. Keep a stable base of support. Bend through your knees and hips rather than bending at your waist. Avoid twisting your back. When changing direction, move your feet and turn your entire body rather than twisting through your spine. Never attempt to physically overpower a transfer. If the client suddenly cannot support their weight, becomes dizzy, or requires more assistance than expected, stop. If you need another trained person or specific equipment, obtain that assistance before proceeding whenever the situation allows. Trying to complete an unsafe transfer can result in injury to both you and the client. For clients whose care plan permits a standard assisted sit-to-stand transfer, positioning is important. The client should usually be brought toward the edge of the chair, with their feet positioned securely. The client should use the chair or approved support surface to assist with standing whenever able. Do not yank a client upward by the arms, shoulders, or hands. That can cause injury and does not provide safe support. Always follow the specific instructions provided for that client. After the client reaches a standing position, give them a moment. Do not immediately begin walking. Some clients may experience dizziness or changes in balance when they first stand. Observe the client and ask how they feel. If they appear weak, dizzy, unstable, or unable to safely continue, assist them back to a safe seated position when possible and follow agency procedures. When assisting a client with walking, Stay alert throughout the entire activity. The client should use prescribed assistive devices such as a walker or cane according to their care plan. Do not move so quickly that the client has to rush to keep up. Watch for dragging feet, stumbling, shortness of breath, sudden weakness, fatigue, or changes in balance. If the client becomes unsafe, stop and assist them to a secure location if possible. Assistive devices only improve safety when they are used correctly. Never encourage a client to use a damaged walker or cane. Do not replace one type of device with another unless that change has been authorized. Make sure there is enough room for the device to move safely through the environment. If equipment appears broken, loose, unstable, or unsafe, report it promptly. Wheelchairs require careful attention. Before transferring a client into or out of a wheelchair, make sure the wheelchair is stable and the brakes are locked. Footrests should be moved appropriately during transfers. When transporting a client in the wheelchair, make sure their feet, hands, clothing, blankets, and personal items are positioned safely away from the wheels. Follow the client's care plan regarding positioning and safety devices. Some clients may have equipment intended to assist with transfers or mobility. Care partners must only use equipment they have been trained and authorized to use. Do not improvise with sheets, clothing, furniture, or other household items. If the client's required equipment is missing, damaged, or does not appear to be working properly, stop and report the issue. Never use unfamiliar mechanical equipment without proper training. If the care plan requires two-person assistance, that means two appropriately trained people are needed. One care partner should never attempt to replace two-person assistance by simply using more strength. Both people should understand their roles before beginning. Communication and coordinated movement are essential. If the required help is unavailable, contact your supervisor according to agency procedure. One common caregiver injury occurs when a care partner tries to catch the full body weight of a falling client. Your instinct may be to grab the client and hold them upright, but this can cause serious injury to both of you. Do not twist your back or attempt to support more weight than you safely can. If you have been trained to safely guide a falling client toward a lower surface, use that training. Once the client is down, follow the agency's emergency and fall procedures. If a client falls, do not immediately pull them back to their feet. The client may have an injury that is not immediately visible. Stay with the client and follow the agency's emergency procedures. Emergency medical assistance may be required depending on the circumstances. Notify the appropriate supervisor and complete all required documentation. Never hide or minimize a fall. Changes in mobility can be important signs that something has changed in the client's condition. A client who suddenly needs more help than usual should not simply be treated as though nothing has changed. Document what you observe and report significant changes according to agency procedures. Do not diagnose the cause. Your responsibility is to recognize the change, maintain safety, and report it. Unsafe transfer practices can result in serious injuries. Never pull a client by their arms or shoulders. Never ignore safety equipment or wheelchair breaks. Never rush a client simply because you are running behind schedule. Do not change the approved transfer method on your own. And always report falls, near falls, new weakness, or changes in mobility when required. A simple way to remember transfer safety is stop. First, set up the environment. Second, tell the client what is going to happen. Third, observe their ability and current condition. And finally, proceed only when the transfer can be completed safely according to the client's care plan. Before completing the lesson, review these questions. Wheelchair breaks help prevent unexpected movement during transfers. Clients should not be pulled upward by their arms. If the client suddenly requires more assistance than usual, stop and report the change. After standing, clients should be given time to stabilize and checked for dizziness, weakness, or balance problems. Following a fall, remain with the client, follow emergency procedures, notify the appropriate personnel, and document the incident.